Senator Cormann.
Acting Deputy President, before question time, when we started this debate, I was pointing out the absolute failure the Rudd Labor government has been in the health portfolio. Senators would remember my comments before question time, how before the election the Rudd Labor government promised the world on health, and they've delivered next to nothing. All we've had is a whole series of reviews, followed now by reviews into those same reviews, a return to the bad old-fashioned crusade against private health, and the occasional lazy, ill-thought-out, short-sighted budget cut, usually targeted at those Australians who access services through the private health system. But like one of the reviews which the government commissioned on coming to government was the National Preventive Health Taskforce. That review went for 15 months. It considered all of the issues. It considered the best way forward from their point of view. And it made a whole series of recommendations. Now, the Minister received the report of the National Preventive Health Taskforce on the 30th of June, and we were led to believe at the time that the report would be released. At the last minute, the release of that report was canned because somebody in government, and I can only guess who, somebody in government made a judgment it was too hot to handle. Too hot to handle. Some tough decisions would have to be made, and there may well be some consequences in terms of public opinion. Now, so the government then sits on it for 2 months, and it was only an order of this Senate which forced the government to publicly release the National Preventive Health Taskforce report on the 1st of September. It was a disgrace that we had to wait for those 2 months. Now, ever since then, has the government done anything? Has the government made any announcements in relation to any of the recommendations about what should happen to tobacco excise, what should happen to alcohol taxation, what should happen to alcohol advertising, what should happen to a whole series of other recommendations? No, they have not. In fact, when the Leader of the Opposition, in his budget reply speech, made the very sensible and constructive suggestion that we should increase the excise on tobacco by 12.5%, the government came out and opposed it. They pooh-poohed it. It was an eminently sensible suggestion. Now, what is the minister scared of? What is the government scared of? Like, why are they not prepared to take on the tobacco companies? Why are they not prepared to make some tough decisions in the health portfolio when it comes to alcohol taxation, when it comes to a whole series of other issues? Now, the minister has been out there saying that the opposition wants to delay or block this bill. We don't want to do anything of the sort. I can't believe that the government would make such an incredibly unbelievable suggestion. Because if you look at the second reading amendment we've put forward, what we're saying is that this bill should be considered only after the government has tabled the response to all of the recommendations to its own National Preventive Health Taskforce review. Now, I mean, that is eminently sensible. And what it means is that if the government comes into this place today and tells us which recommendations they support and which ones they don't, we would be able to deal with this in very good time before the 1st of January 2010, which is when this particular agency is supposed to come into effect. Because we do support effective preventative health measures, but what we don't support is just setting up another agency without a clearly articulated purpose. And I mean, this government uses bureaucratic processes, it uses reviews, task forces, committees of inquiry and further reviews and new agencies to avoid making decisions. This is a strategy to create this impression how the government is busy. Busyness instead of focus on outcomes. Now, one of the real problems we've got in the health portfolio, and one of the things that any future Australian government will have to address is duplication and management in the health system. Now, this is yet another bill which is going to create duplication, and I'd be very interested to hear the response from the government in relation to the points that I'm about to raise. I mean, we are here being asked to support a piece of legislation in relation to the setting up of the National Preventive Health Agency, which will be funded at a total cost of $133.2 million over 4 years, which includes establishment costs of $17.6 million, and it will oversee a spending of $102 million on a national social marketing campaign targeting obesity and smoking, and research spending to support policy development with total $13.2 million. Now, the reality, Mr. Acting Deputy President, is that the Federal Health Department, Nicola Roxon's own department, already spends $31 million per year in departmental expenses for 2 programs that administer $204 million in funding for disease prevention and strategy. Now, both those programs already include national-level social marketing campaigns targeting obesity and smoking. Now, this figure includes, and this comes straight out of the budget papers, it includes $152 million that has already been allocated for the existing drug strategy program in 2009-10. $24 million of that total has been allocated for departmental expenses. Now, in 2009-10, the department will continue its existing social marketing campaign aimed at raising awareness about the risks of overweight, obesity, and in total $52 million has been allocated, including the promotion of healthy lifestyles, reducing and preventing diabetes, and detection and prevention of cancer. $7 million of the total has been allocated for departmental expenses. Now, and the list goes on. The reality is this, Mr. Acting Deputy President, like, we support effective preventative health measures. But, one of the other measures in the budget is actually going straight counter to that. A cataract surgery is a very effective and a very cost-effective preventative health measure. It helps to prevent falls, it helps to prevent fractures, it helps to prevent mental distress from going blind, it helps to improve quality of life, it helps to prevent social isolation, it helps to prevent early institutionalization. It is one of the most effective and cost-effective preventative health measures currently being funded by the Commonwealth. Yet this government wants to cut it in half. Mr. Acting Deputy President, our main criticism with this piece of legislation is that the government is putting the cart before the horse. They came with all these promises about what they were going to do in preventative health. The reality is, in 2 years as Minister for Health and Ageing, Nicola Roxon has not been prepared to make one single hard decision. Because some of these areas that this preventative health strategy has to focus on, tobacco, alcohol, obesity, food. There are some, we understand there's some difficult decisions to be made. But the minister hasn't made them. The Rudd government hasn't made them. They had a 15-month review, and nothing has happened since then. The minister has ducked for cover. She's refused to release the report for 2 months. She's been sitting on it for 4 months without making a decision. Now, the reality is this minister is unable to make decisions right across her portfolio. We've had her inability to make a decision in relation to the ill-considered chemotherapy budget cut. She's been unable to make a decision in relation to clinical treatment guidelines for ADHD. She's been unable to make a decision on any of the recommendations out of the National Health and Hospital Reform Commission. And she's been unable to make a decision in relation to any of the recommendations in her own National Preventive Health Taskforce report. So we've got report after report piling up, and we've got the minister ducking for cover, and instead of telling the Australian people how she proposes to move forward in terms of the price of tobacco, in terms of alcohol taxation arrangements, in terms of various other advertising, etc., she's ducking for cover, and she's just going to set up another agency. Now, we acknowledge that this agency can do some good work as long as it's well targeted and as long as it's targeted on tangible, effective outcomes. But what we are worried about is that this is just, for this minister, it's just part of another delaying tactic. It's just part of a process of making people believe that she's doing something when she's doing nothing. Now, Mr. Acting Deputy President, this is a very serious concern. Now, the objectives of preventative health obviously is shared by all. We all agree that we should encourage healthier lifestyles and thereby reduce pressure on an already overburdened health system. I've already mentioned that the government's decision on cataract rebates will actually put more pressure on our health system, in particular our public health system, and it will put more pressure on elderly Australians. It will result in more falls, more fractures, more mental distress and more early institutionalisation. But we support strong preventative health measures, including in relation to tobacco, alcohol, food, etc. However, there is a very fine line between giving people the information they need to make informed decisions and the nanny state telling people how to live their lives. And we don't believe that preventative health should be about social engineering. We believe that preventative health should be focused on achieving serious, tangible and practical positive health outcomes. Now, on any of these counts, this minister has failed. She has failed to make tough decisions. She's failed to look the vested interests in the eyes and say, okay, well, this is the way forward. Because all we've got from this minister, and I hear interjections there from Senator Evans. Well, I'm sure that you would do a better job at this portfolio, Minister. I mean, good senator from Western Australia. I think that you should go to the Prime Minister and ask for the health portfolio. I think you should ask it for the health portfolio, Senator Evans. Because this minister, in 2 years as minister, has not made one single tough decision. Yeah, I mean, maybe Senator Sterle would do a better job. I can see him put his hand up. Senator Sterle would like to make a contribution in the health portfolio. I'm sure that Senator Sterle would be able to make a few tough decisions, because certainly Nicola Roxon is not able to make a tough decision. Nicola Roxon has been sitting on her hands for the last 2 years. She's been running review after review. We're now having this exercise of a review into the review, with a propaganda exercise across Australia, with the Prime Minister and the Minister for Health and Ageing going for photo opportunity after photo opportunity at a hospital near you, Mr Acting Deputy President. I'm sure that Nicola Roxon and the Prime Minister will turn up for a photo opportunity at a hospital near you. I'm not sure how much that will achieve in terms of better health outcomes. In fact, I dare to say that it won't achieve any better health outcomes. And if you look at all of the data that's come out in recent times, the situation in our health system is worse today than what it was when the Rudd Labor government was first elected to government. I just recap, Mr Acting Deputy President. In health, before the last election, Australians were promised the world. They were promised that the Rudd Labor government had a plan to fix public hospitals. And if they wouldn't achieve it by the middle of 2009, they would put a proposal to the Australian people for Canberra to take over the running of public hospitals. No progress has been made at all. After the election, rather than implementation of a plan, we had a 20-month review, which is now being followed by a review into the review. We were promised that the government was supportive and committed to retaining the existing private health insurance rebates and the overall private health policy framework, only to find out after the election that the government had returned to its bad old-fashioned, inglorious past of running a crusade against private health. We were told that health was going to be a high priority area, only to find out that in 2 successive budgets, while there is reckless spending everywhere else, in every other portfolio of government, in the health portfolio, there is ill-thought-out, short-sighted budget cut after budget cut. Now, we are supportive of preventative health. We are supportive of effective preventative health measures. And we are not interested in delaying this bill. But if our second reading amendment, which I move now, Mr Acting Deputy President, if our second reading amendment is successful, it is going to be up to the government how quickly we can deal with this. Because we would be able to deal with this before the end of the year very easily. All the government has to do is give us a list. Yes, we support this one. No, we don't support that one. We may support part of this one, not in its entirety. The Australian people deserve to know what direction this government is proposing to take on preventative health, as the Australian people deserve to know what the direction of the Rudd government is going to be for the remainder of its term in the health portfolio generally. For 2 years they've been ducking and weaving for cover, and we haven't seen any serious answers.
Order. Senator Cormann, your time has expired.